Thank you. Thank you all for being here. I know where a lot of you are. It's early. It's midday for me here. I will tell you that uh, I'm going to be using a lot of what we discussed today because I'm in the Tampa Bay area. So a lot of you probably know we have not had a easy few weeks with Hurricane Helene and then Hurricane Milton. We're just coming out of that. In fact, the university where I teach is not open as of yet because of power and safety issues and all of that. So I'll be enjoying doing work on self-care today with you all, doing some grounding techniques and taking care of ourselves. All right. So as far as introducing myself, I have a master's in criminology from the University of South Florida, and my career has been primarily working with people who have substance use disorders. And of course, along with that always comes, mental health, co-occurring comorbidities, trauma, a lot of the different issues. And so because that was my work for so long and I ran treatment centers, I really started getting into training the staff in terms of taking care of themselves because we know the turnover in this field can be really constant. And I just didn't like some of the effects I saw in my staff and my teams and, probably in myself as well. So I've been working for many years on self-care trainings. I've done them internationally and domestically. So what are we going to do today? We are going to work on understanding how trauma works. I think we have sort of a general idea, but we're going to go into what does it really mean? Why is it important? Then we're going to talk about authentic self-care. I don't know if you've heard this term or if you saw that in the title and were like, what does that mean? But we're going to talk about what that is and why it matters. And then we're going to go into boundaries and self-care tools. So my hope is that you'll leave with a little toolbox, a little toolkit. I know how busy each and every one of you are. I know that a lot of you are working while you're listening to this training. And so it's incredibly important to me that when you leave, when you're done today, that you have something tangible that you can use and hopefully a few things. So that being said, of how busy you are and how important the work is that you do, I really want to thank all of you for being here and sort of just give yourself credit that you're taking this time. I know you're busy. I know that maybe self-care doesn't feel like the most important thing on the list, but it is. And you will much better be able to help your clients and the people you work with by taking care of yourself. So thank you. So I mentioned a little bit about how I got here. One of the things I didn't mention is that I went to yoga teacher training and I have taught yoga for many years. So that kind of combined with my counseling and working in a nonprofit and all of that sort of came together. And then most recently I worked internationally for, it was a program that was funded by the federal government, and we were trying to educate universities around the world about addiction because a lot of universities, as you can imagine, don't have any programs. Like I trained university and professors in Uganda, and they don't have any addiction program. Now they have treatment programs, but they don't have anyone being trained through the universities to work in those programs. And now I teach at the University of South Florida. Okay, so nice deep breath. I can see some of you're not taking a deep breath. Take a deep breath. You probably haven't yet today. There you go. Okay, so what is trauma? I think this is one of those terms that we think we understand. I just did a class on this with my students and I asked them what were they surprised about? And I think what a lot of people are surprised about when they learn about trauma is that we sometimes use the term incorrectly. So trauma can be defined as a deeply distressing or disturbing experience, but it's also the emotional shock that follows a stressful event. And of course, a trauma can also be a physical injury like a brain trauma. So I sort of look at it as subjective and objective. So if something difficult, well, I'll use my family. So my children were with their father during Helene. The house got flooded. Their, possessions were lost. It was scary. That is a pretty objectively scary thing. But what's interesting is whether it's going to become traumatic or not. For some people, they are going to carry that with them throughout their life, and we'll discuss what that will look like. For some people, it'll be upsetting, and then they'll sort of process through it, and it won't have a trauma effect throughout their life. So the event is the same, but the effect is different for different people for a number of reasons. Resiliency factors, protective factors, there's a lot of different things. For example, with my kids both being in a home that was flooding, my older son is 16 and he's a big kid, and he probably wasn't as scared physically. My 12-year-old is very petite and probably felt like, this water could sweep me away. So it's a scarier experience, even though objectively the same thing happened. So according to the American Psychological Association, trauma is the emotional response to a terrible event, like an accident, a rape, or a natural disaster. However, a person might experience trauma as a response to any event that they find physically or emotionally threatening or harmful. So let's break it down. Emotional, it's the response. The event is considered terrible. A lot of times it's physically or emotionally threatening or harmful. So if the person feels unsafe, an example I use with my students a lot is if someone comes into our classroom and calls someone a name, they're like loud and they say some terrible name to someone. If some people are going to be upset and find that threatening, some people might laugh, some people might just be confused. There's a lot of different ways that people can respond to that. So a lot of it has to do with perception. Okay. So sometimes we use the word trauma to describe the event. Sometimes we use it to define the response. We're going to try to make sure we have clarity on which one we're discussing. But a lot of it is really the level of stress and the reaction to the event more than the event itself. So a lot of us have heard about different trauma responses like fight or flight. We do have some other responses that people have, scientists and researchers have found out about. So in addition to fight or flight, there's also fawn, freeze, flood, or fatigue. I guess they really wanted them all to start with F because I think we probably could have had better names for some of these, but we'll go with it. So, for example, fight or flight that we're more comfortable or knowledgeable about. If something is threatening and I respond by fighting back, right? That is a fight response. If I run or try to hide or get away from that whatever is scaring me, that is the flight. Freeze is basically if any of your clients, or if you've had the experience where someone like disassociates and just basically like kind of isn't there in their mind, that is freeze. Fawn is like, I'm going to try to placate. I'm going to be the best people pleaser I can possibly be right now so that perhaps this won't be so bad right now. Flooding is being flooded with emotions in response to the perceived threat. And then fatigue, I don't know about you guys, sometimes I get this, feeling tired or sleepy in response to a perceived threat, like if you just sort of overwhelmed and it's like your body almost wants to just shut down and maybe rejuvenate or take a break. So there are different types of trauma, and we're not going to, do the DSM and go through all of it, but just to make sure we're kind of on the same page. Acute trauma, sometimes called type 1, is like a single stressful or dangerous event. So if, my children, because of the hurricane, had some level of trauma, it might be acute and hopefully would not last too long. Chronic trauma, or type 2, is repeated and prolonged exposure to highly stressful events. So maybe child abuse, domestic violence, bullying, it's ongoing, unfortunately. Complex trauma, some people have heard like complex PTSD or CPTSD. This is exposure to varied and multiple traumatic events that are really invasive and interpersonal, like abuse or profound neglect during childhood would be an example. So I have a few quotes about burnout and compassion fatigue. And we want to just be clear that burnout, compassion fatigue, vicarious trauma, these are all different in their way. They all may have some similar starting points and some overlapping symptoms, but they're not all you can't just interchange them. So burnout, to deplete oneself, to exhaust one's physical and mental resources, to wear oneself out by excessively striving to reach some unrealistic expectation imposed by oneself or by the values of society. So I have worked with a lot of peer recovery support folks in my day, and my guess is that a lot of you probably have pretty unrealistic expectations of yourself, and you're gonna give and push yourself because you want to help. And so that's a beautiful thing, and we'll talk later about how that can also be a risk factor for you. And then compassion fatigue, a state experienced by those helping people in distress. It's an extreme state of tension and preoccupation with the suffering of those being helped, and it can create secondary traumatic stress, which we will talk about in a minute. So, folks who start out with a great deal of compassion, which I'm sure, I know I did, and I'm sure many of you did. And then over time, I've seen people who were counselors with me who began to not have that level of compassion because perhaps it's a lot to maintain. And so it was difficult for them when people would not be successful in treatment or would struggle or would continue to make, what they perceived as the same mistakes. So vicarious trauma, we're going to spend a good amount of time on because I really want, sorry guys, all of us to understand how this can affect us personally. And the other ones may have as well, but we're going to focus more today on vicarious trauma. But the good news is that the self-care techniques we'll discuss can help you if you're in burnout or some level of compassion fatigue, or if you're experiencing vicarious trauma to some extent. So it was first identified in the 80s as what they called the cost of caring, which I thought was very interesting and apt description. So clinicians or professionals who listened and empathized with their patients all day were experiencing feelings that were different than burnout. These experiences were defined as unfavorable changes, both affective and cognitive. And basically, they're listening to people's stories, and some of those stories are really terrible. And so they start to feel as if in some ways they're carrying that trauma now. If any of you have read the book, The Body Keeps the Score, that's a really interesting book that talks about how even if you don't realize that you are carrying trauma with you, if you look at these certain symptoms, you'll realize you probably are. So vicarious trauma symptoms can be similar to post-traumatic stress, like re-experiencing traumatic events mentally, numbing, avoiding, or having persistent arousal. So I had one of the folks who worked with me when I was doing trainings, who he had to sit in the back. He couldn't have anyone behind him because he had hyperarousal and would be fearful if there was someone behind him, or like if people could walk behind him. So professionals who have previous trauma histories show significantly higher secondary trauma symptoms than those with no trauma history, which I think makes sense if we think about it. So if we come to this work with our own trauma, there's a vulnerability there. And so when we start hearing other people's trauma, we can probably really empathize in a way that could be a risk factor for us, and we have to make sure we're taking care of that. So researchers have found that the somatic and emotional artifacts, the memories that were shared by someone else, can imprint on the brain and the body of the receiver. So I think one thing that I've learned from doing this work for a while is that it's important to remember your brain doesn't know the difference between a lie and a truth. So if you tell your brain that you're in trouble, it believes you and it responds as such. And so after my kids went through the flood, I was imagining it even though I wasn't there. And so that would put my brain into like, we're in danger, or there's a trauma here. So it's really important for us to remember that the story we're telling our brain is what it's going to believe. So that's why things like self-talk are so important. We're going to talk about a lot of different tools that can help with this. But in this case, it's much like firsthand trauma when you're hearing about very difficult things. And we might begin to feel that experience in our own body, even though we weren't there. So a professional like yourselves, or someone working with someone who is working with folks who've had trauma, might avoid certain situations, places, or things, might have bad dreams, be hypervigilant, experience grief, anxiety, irritability, a morbid preoccupation. So if you've heard of like doom scrolling, like looking kind of for negative on the phone, or things like, headaches, heartburn, ulcers, things that are your body telling you that it's, the pain is a symptom that we need to look at. So one of the things that I think is really key when we're trying to see if we're experiencing vicarious trauma, and just something that's a dangerous flag for us to look at, is when we start to see the world differently. When we start to feel that the world is not just, or it's not safe, if we start to sort of have a loss of hope or not as much purpose, or if things that you used to experience like, spiritually, like peace or joy or patience, or all of those type of things are difficult to tap into, then you might be experiencing some of these symptoms or challenges that are, not insurmountable. That's why we're talking about them today. We want to be mindful and then see what we can do. So sometimes secondary traumatic stress, as I mentioned, is called compassion fatigue. And this can happen sort of quickly as opposed to some of the vicarious trauma or burnout. It's very responsive to evidence-based treatments and interventions, so we can get that compassion back. But again, we have to be mindful and know that that's what we're dealing with. Okay, so now we're going to go into some of the science. Not everybody's thing, I know. I love it. I love to, I'm definitely not a neuroscientist, but I love to understand what is happening in the brain that's making us feel this way. How does this make sense? So animals, if they have a life threat, they actually literally will shake. So I'm not going to sing Taylor Swift, but you can have that in your earworm in your head for the rest of the day now to shake it off. And what that does is it actually helps the animal discharge the energy of the traumatic event. We have Halloween Horror Nights here in Tampa. Well, it's in Orlando. And so sometimes I'll go through the haunted houses with my partner. It's not really my thing, but he and his son love it, so I'll go. And when I get out, I literally like feel myself, like I move my body in such a way. And I think it relates to this. Like you're experiencing a perceived threat and you like discharge that energy. So with animals, the trembling or the shaking that might happen comes from the limbic part of the brain where the emotions are held. And the shaking basically tells the brain you're good. You can shut off that fight or flight. And we'll talk about some other ways that we can do that and why it's so important too. Animals actually can die if they don't shake off that trauma. Humans, we don't die from it, but we experience mental or physical illness until we can shake that trauma to, or intervene and find healthy coping skills for it. And so we know not everyone responds differently, and some people can fairly quickly come back from it, and some people experience it for a long time. So a lot of this relates to the nervous system. And when the nervous system can't complete the natural survival-based response, basically fight, to fight or to flee or whatever it might be, then this creates a problem. And the reasons that you might not be able to do a survival-based response would be something like being immobilized, being held down, being a child who doesn't have any power in that situation. There's multiple ways that the experience can just stay stored in the body. All right, so I love my little pictures here, help us understand. So when we're experiencing a threat, there's a physical and emotional reaction that gets evoked, and it activates the sympathetic nervous system. And I love this from my yoga standpoint as well. And so you can see like the brain stem through the spine. Your pupils are going to be dilated. You're not going to salivate as much. You'll have a higher heartbeat. The digestion is going to slow down. You're going to have the secretion by sweat glands, constricted blood vessels, relaxes your airways. So from a biological perspective, and you can unmute if anybody has a thought on this, why does that happen? Why does that make sense? If you prefer to put in the chat, that's fine as well. Sure. The question is why evolutionary wise would your body make all these changes when you're experiencing a threat? Yes, Lisa. So Lisa said, because you need to focus on dealing with the threat. And that's exactly right. So if a bear is coming at me, I don't need to worry about, for survival, exactly. Actually, I see the comment to be able to think better. Carrie, we're going to come back to that because shockingly, it's sort of the opposite. So I don't know how to pronounce your name, Mr. or Miss Bolton. All of your energy can be used to protect yourself and not on unnecessary body functions. Perfect. So when you are in a threat, exactly, Melanie, it shuts down everything you don't need. When you're in a threat, you don't have to digest food. You don't have to do anything but fight or run, right? If we look at like the traditional kind of fight or flight. So you get more blood to things like your thighs, your arms, anywhere you might have to like fight or you might have to run. And actually, to go back to one of the things which I appreciate you saying, you don't think better, you actually think worse. And we're going to talk about that. But your survival skills get you either the hell out of there or I'm going to punch this bear in the face. Maybe not the best choice, but those are, So thank you everyone for your thoughts. You had it. So that's a good thing. If I am in danger, let's use a more recent example. If I am walking down the street and I realize that I am on that street by myself and there is someone coming up behind me and I might be at risk, I want my body to do the things it's supposed to do to get me the hell out of there. It's like, when mom can lift up a car to save their children, right? Their brain isn't gonna, it doesn't make sense that they can do that, but the adrenaline, all the physical things come into that. So if I think someone's behind me and I'm scared and I need to start running, that's what I want to do. I don't want my body to worry about trying to digest the food I ate recently or my bladder or my anything else. Great. So when I run away and I get home and I am safe and I lock the door behind me, I should begin to relax and come back to a healthy homeostasis. The problem is, and there are lots of reasons, sometimes the sympathetic nervous system remains activated. It remains on high alert. So has anyone ever had like a stressful experience and then it's over and it's done and you're good, but you just feel like you're sort of stuck there, like you can't calm down, you still feel like irritated, or you still feel you're any kind of anything that is still like aroused, like you're exhausted, maybe you're still like kind of feel like you're supposed to do something. There's a lot of ways that can go. Anxious, absolutely, that's a big one for me. And part of the reason that happens, yes, Del Sue, you might be shaking. That's a good one. Part of the reason that happens is because we've sort of lost our natural evolutionary ability to come down from that threat, because we have a lot of in-between threats, right? You have emails, you have bills, you have whatever might be putting you on alert. So one of the things that we get when we go through a stressful or threatening experience is cortisol. Cortisol is a stress hormone that, again, is generally good. Like, I probably had some increased cortisol before I got on here with all of you because I'm meant to present, I want to do well, etc. But with the way our society is right now, with sort of constant notifications and constant things coming at us, it can be difficult to decrease our cortisol and get back to a healthy place. So, and when we look at it from a trauma standpoint, and even more severe standpoint, the brain and the nervous system can actually get stuck in the trauma, and the brain can ultimately actually get rewired to be more in that trauma loop than in a normal day-to-day. So again, keep in mind, none of this is without hope. We will be spending a lot of time on what can we do about it. So don't get discouraged. So we have three parts of the brain: the reptilian brain, which is responsible for the survival and the autonomic body processes like breathing; the mammalian or limbic midbrain, which processes emotions and conveys the senses; and then the neo-mammalian, or the cortex, the forebrain. I heard someone on a podcast this morning talking about someone who was young and said, wait till your frontal cortex comes in, which I thought was cute. So, this controls our cognitive processing, our decision making, our learning. This is like that executive functioning, right? So what happens is that the reptilian brain is activated during trauma. We're in survival mode, like you guys said so well. Usually we can shift back into normal functioning. We can start to think more clearly when the trauma or the threat is over, but sometimes that doesn't happen. And when that doesn't happen, our stress and our hormones stay in that survival mode. And when you think about it, this makes perfect sense for the symptoms that you experience when you look at someone with PTSD or with vicarious trauma, the reptilian brain is still looking for a threat. So if you think about hyperarousal, not being able to sleep, being irritable, being anxious, that makes sense if your brain still thinks you're in danger. So a big part of what has to happen is to tell your brain, I'm okay. So the survivor of the experience remains in a reactive state, which means constant stress mode. And there's a couple things that happen in the brain. So you get an overstimulated amygdala. This can get caught up in a highly alert and activated loop, and you see threats everywhere. The hippocampus is going to be underactive then. So it's less effective in making synaptic connections that are necessary for memory consolidation. So the mind and the body can stay reactive, because basically what they've done is, instead of taking this experience and putting it in the memory bank, it's still kind of happening. And the brain doesn't really understand, no, that's done. The threat is over. And if you think about, if you've worked with someone who maybe experienced a crime and you talk to them about it, you know that people will sometimes not be able to remember, a lot of things. And we know how difficult that can be because of trauma. So continuing the brain dysregulation, you might have a constant elevation of those stress hormones that I talked about earlier, and your nervous system remains highly activated, which is going to create fatigue because you are taxing those symptoms like the adrenal gland that is not supposed to work constantly. It's like, dude, I'm like a very part-time worker and you have me on like overtime here. Then you have GABA. I'm not going to try to pronounce that full name. GABA is the calming agent that is produced by the brain. And during stress, GABA is lowered because you're not supposed to be calm at that moment, right? If there's a threat. And adrenaline's increased, but the GABA has to come back in so the nervous system can calm down. So I mentioned the prefrontal cortex. This is the thinking center of the brain, and it can be affected by trauma in that, as I mentioned earlier, it's not really going to be doing its job, because if I'm in immediate trauma, I just need to run, fight, do something to be okay. I need to survive. But this area is responsible for like your rational thought, your problem solving, your planning, your empathy. This allows us to make good decisions, to think clearly, and to be aware of ourselves and others. And it's not going to be in working order when you're still in a reptilian brain. So the ACC is responsible for our emotions. So this is your emotional regulation center. And if the ACC is strong, then it can manage difficult emotions, but it won't let them take over. So here's the unfortunate thing that happens when we're dealing with a traumatized brain. The thinking center is underactivated. So those executive functions that we need are lowered. The emotional regulation center is underactivated. So your emotions may be driving the bus. And the fear center, the amygdala, is overactivated. So again, you have emotions kind of out of control, brain is not really, the thinking executive functions are not really getting too much into this, and the fear is the one in charge. The primitive brain is going to be in charge, and the higher functioning parts are going to be more passive. So it's difficult. It might even feel impossible to manage emotions, to let go, or to calm down. And I don't know about you guys, but I've definitely had moments like that. Thankfully, they're fewer and far between and not constant. So I think a key thing to walk away from, whether it is for yourself or your clients or anyone that you know who has dealt with trauma, is that the traumatized brain is literally different. So I like these, this is a PET scan, the top one, and it's experience, you can see someone with a normal child's brain, and then one who has experienced adverse childhood experiences. And you can see PTSD versus no PTSD, and a healthy brain versus one with PTSD. So again, I think it's really important for us to keep in mind that there is literally a difference. So two things. Does anyone have any questions so far? You can raise your hand or you can put it in the chat if you do. I know that was a lot, so I don't want to keep going and not give you an opportunity. Okay, well, I'm going to have us do a breathing exercise. So this is a very simple breathing exercise that relates directly to what we were just talking about, because what it does is it speaks to your parasympathetic nervous system and lets it know that you are safe, so that it can begin to release stress hormones like cortisol and other things that are on alert and that are overactive when they don't need to be. So find a comfortable seated position. If you can, try to have your feet on the ground, and perhaps you're supported by the chair. Bring the shoulders up to the ears and then roll them down the back. We often hold a lot of stress in the shoulders, and our shoulders end up being like earrings. If you want to close your eyes or gentle gaze somewhere in the room. And we're going to take a nice deep breath in through the nose, down the chest into the belly, and exhale. And one thing that we want to try to do when we're doing breathing, especially when we know that we are in stress, is to try to make the exhale longer than the inhale. So it doesn't matter what length. If you can do, 3 seconds in and 5 seconds out, it might feel forced at first, but you can practice it until it becomes something you're able to do more comfortably. So maybe it's, 1, 2, 3, and 1, 2, 3, 4, 5. And try a few breaths at your pace. It's in through the nose and out through the nose. And one of the things I love about this breathing technique is you can really do it anywhere for as long or as short as you want, and it's directly speaking to those stress parts of the brain and the body. We'll take 2 more nice deep breaths and then we'll come back. All right, coming back into your body, into the room. Another thing I really like about that breathing technique is that if you are we're going to talk about how we fit all this stuff in later. If you're going from client to client and you're not you're feeling anxious, but you don't know how to take time to do something like that, just do it with your client. The next client who comes in, okay, we're going to do some deep breathing together to ground and to start our session well. And this is a good tool for you. It's a good tool for me. So it's a really nice way to model care as well. Okay, so moving on here. We're going to talk about some of the physiological effects of trauma. Thank you, Amy. I'm so glad. It's awesome that you meditate at all. What's sad to me is that I think sometimes we go days without just taking a deep breath, which is, it tells us a lot about how we're going, right? So Trauma affects the body's central stress response. We talked about that, including the hypothalamic pituitary adrenal. And this makes us more reactive to stress and more likely to create the stress hormone cortisol that I discussed. Cortisol can be toxic when it's always high. And the great thing is, we just decreased some of our cortisol just there in that short period of time by doing those deep breaths and by focusing on the exhale being longer than the inhale. So cortisol can actually, the research shows it can lead to increased risk of depression and heart disease. Normally we have that stressor, the cortisol comes and the stressor passes and the cortisol reduces. But someone with trauma might continue to produce, or someone who just really doesn't take a pause in between. So I know, when I'm feeling stressed and then I'm feeling work stress and then I maybe take care of something at work and I move on and then my kids need me and then the house is dirty and then, you don't take a minute or you go from client to client. And so it's really important to stop one stressor, at least in the body, before we just pile on, because now you have cortisol up to here because you're stressed. And then when you add stress, you're at potentially kind of an overload or a toxic or unhealthy amount of stress hormone. So this is a time I wanted to get your input as well. What we might see during this time, if someone is feeling these physiological effects of stress or especially trauma, are maladaptive coping skills like smoking or drinking, managing or numbing the stressors and the pain in some way. So do you guys see this in your clients or in yourself? And what are some other coping skills or maladaptive behaviors that people do when they're just feeling so much stress or so much symptoms from trauma? You're welcome to unmute, or if you prefer, you can write in the chat.
I know that a lot of, like, sometimes I used to do it, and a lot of my clients, a lot of times we just sleep through it all, like sleeping as much as possible.
Yes, thank you, Athena. That's a really, yeah, and people might not see that as a trauma response, right? It's like maybe, you're perceived as being lazy or maybe depressed. But yeah, it's a way to, I can't cope with what's happening and I'm just gonna kind of shut down. Thank you.
Another one that I've noticed is overeating or undereating or drugs or at least when I'm manic, I like to change my hair a bunch.
Oh, yep.
Yeah.
Kaylina, is that how you pronounce your name?
Yeah.
Yay. So thank you so much for sharing that. So what do you think those things have in common?
For the most part, they're like comforts. They comfort you in that time. I grew up in drugs, so like it was very comforting. It was home for me to do drugs. And for other people, it's a coping skill to manage or numb it.
Yeah. And a
Yeah.
lot of times with the food, there's also a control aspect,
Yeah. Yep.
right? So
If you have a lack of control, at least you can
Mhm.
control what you're eating or what you're not eating. Yeah.
Exactly. So, you'll see that with children, like they have so little control in their life or their decision making, even if they're not in a dysfunctional home, right? And they'll, you can't physically make them eat their, peas or whatever, right? So absolutely. But you're right, comfort, which we could see as like numbing or throwing yourselves into something, but not what's actually going on, right? Excellent.
Yeah, exactly, for sure. Whatever makes it go away in the moment. Yeah.
And that's what's so interesting, right? Is that you said it so well. Someone who has a maladaptive coping skills wants the thing to go away in the moment, but then it like often just comes back tenfold, right? And you might be creating other problems. Someone who has a level of healthier coping sort of faces the thing,
Mm-hmm.
and they might have to do it a few times, but probably less than the person who's avoiding doing it.
Right. Yeah, exactly. Exactly.
Like I lost my father a few years ago, and I've very much felt the grief. But I
Yeah.
know I have friends who didn't allow themselves to, and it's
Yeah.
comes
And
out in
it's
the
still there.
it's
It's
still
still
there.
there.
Yeah,
Just because you got high or just because you drank and got drunk doesn't mean it's not there anymore. It's still there. You just put a band-aid when you need stitches. You know what I mean?
exactly,
Yeah.
exactly. Thank you.
Yeah.
I'm gonna look at some of these comments. I love that people are participating, whether unmuting or coming and into the chat. So let's see. Oh, I see anger. Oh, anger. Such a good one. Thank you. So I kind of lost where it was here, but thank you. I have such a strong, okay, Rachel, such a strong feeling about this because I'm sure most of you know anger is a secondary emotion. So when you are angry, you're really feeling, God, there's tons of them, but I usually simplify it with pain or fear. So, like, if my kids are angry, I usually ask them, like, are you feeling, are you feeling afraid? Are you feeling hurt? And myself too, I ask myself, like, what is it I'm feeling? But anger is typically a more socially acceptable response than pain or fear, especially for men. And I think it's so toxic because, like, if I'm at work and one of my peers comes down the hall and is like, God damn it, blah, 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 about something, most people are going to be like, oh, okay, whatever. But if a peer comes down the hall and is like crying or expressing fear or expressing pain, it's probably people are going to be kind of uncomfortable or less, so it's like, and it goes with the control thing that Kaylina and I were just discussing, right? When you're angry, you feel like you're in control. You're not necessarily, but it can feel that way. So excellent. Deflecting or projecting onto other people. Oh yeah. Disassociate. Yep. Smoking, stress eating. If I can't handle it anymore, I sleep a lot. Yep. Absolutely. Thank you guys for being so vulnerable. These are excellent. These are all things that we do, whether it's a really, like whether it's to like a disorder, like a substance use disorder, mental health, whatever, or just daily, not super healthy coping. It's just a continuum, right? So I see hygiene, pulling away from friends, spending money. Oh, yeah. Yeah. Retail therapy, right? We joke about it, but that can be really unhealthy when you're, I mean, a few bucks at Target, no big deal, right? But, when it can be really unhealthy when it can put first of all, you're not dealing with the actual issue, like we said, but also it can put you in another situation, just like these other things we're talking about. Lashing out, yep. Pacing, talking to myself too much, closing the office door, hard breathing, hiding from other staff. Yep. Personifying another person and causing a fight with them. Preach, Bethany. Yep. So there are tons of different ways. And how about social media or the phone, right? Do you ever find yourself just on the phone and then you're like, how much time did I just spend on that? And did I actually see anything meaningful, or was that worthy of any of my time? Okay, did anybody else, Kaylina, it looked like maybe you had something else you wanted to say?
I just wanted to like kind of remind people that like with anger, there's usually like an underlying thing. And that's why I try and give grace to most people who are in that anger, because I know they're either hurting or they're going through something, or they're just not wanting to show the actual emotion, or maybe they are just angry. Maybe they are just angry and there's a reason why they're angry. It's not just because they want to be angry. Nobody wakes up and is like, I'm gonna be angry today. Like
Yep,
Like, so
yep.
just like be that person for somebody that is patient with them, you know?
Yeah,
Yeah.
yeah. And I think you hit on two really important things. Yes, obviously sometimes we're just angry and maybe that's valid, but
Mm-hmm.
also those other feelings are so vulnerable. It's
Mm-hmm.
it's you know,
And it's hard to be vulnerable. It is.
mm-hmm,
It's
mm-hmm.
hard. If you've grown up being told don't be vulnerable, or you just feel like you're weak because you're vulnerable,
Yep.
then yeah, it's hard to be vulnerable.
Or vulnerability was punished in your family to some
Yeah.
extent,
Yep.
you know?
Yep.
Like,
Exactly.
why are you crying? I'll give you something to cry about kind of thing, right?
Right. Yeah. Right. Exactly.
My youngest will get very, 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 very angry, and I just get quiet and like, what's going on? And really try to,
Yeah.
and
Yeah.
then they'll like cry or something that's more vulnerable because they like,
Yeah.
they just had to go through it first, you know? So it's,
Yeah.
yeah. So I see some people talking more about shopping, absolutely unfortunate. Um, oh, online games, yes. I think that, you know, and the spending too much on the purchases because you're just like sort of in that world instead of this world. Shopping habit can be disguised as retail therapy, but you're not getting to the problem of whatever's causing you to need to shop. Exactly. And generational trauma, we have to be tough, don't deal, move on. Oh, yes, well said, Brandy. I I took I'm personally recovering codependent, and I had my stepmom was an chronic alcoholic for my entire life. My dad was an enabler, you know, dealt with a lot of that. And I used to be that like blame other people or like have that hard shell. And I've just through many, many, many years of work, let all that go and, you know, being vulnerable. But you have to, it's a practice, and you have to be mindful all the time of, am I falling into any kind of maladaptive coping, or am I like lashing out, blaming other people, whatever it is. So excellent. Thank you all for that. That was great. So we talked about some physiological effects. Here are some psychological effects. Yeah, I'm sure you guys are familiar with the concept of the mind-body connection. So if your mind is experiencing these traumatic events and you're, you know, seeing them or feeling this, your body is going to feel it as well. You might have, some people will have like chronic pain, which reminds me, you guys might be interested in this. I just found an article that said 80% of people who are getting inpatient treatment for alcohol use disorder also have persistent pain, so chronic pain. So I just read that in, what is this? It's a new study published in the journal Alcohol. So if you're interested in that. But, you know, think people will be re-experiencing trauma, like it can be flashbacks, nightmares, distressing memories, emotional detachment from things that are reminders of the trauma. So this might be where, you know, the holidays are coming up and I'm going to be with this family, so I'm going to detach. I'm not going to think about it. I'm going to get on my phone. I'm going to go shopping, all these other things. Increased arousal, feeling jumpy, unable to concentrate, and adverse changes in thinking and mood. So when we think about specifically post-traumatic stress, a lot of this came from attention being paid to veterans who were coming back from Vietnam. Before that time, they would treat people for symptoms like substance use disorders or depression, but they really weren't looking at it as, this is a mental health disorder that is, you know, fits this criteria and people meet this and we need to treat the whole thing. So around that time, there was post-traumatic stress disorder was defined. And, you know, one of the things that I love, and when I think about substance use disorders, mental health, trauma, is how we're hopefully moving away from it just being like you know, we all know, like people say, oh, you just need more willpower with substance use or different things. Now we're starting to understand, this is why I like the brain science so much. No, these are real disorders. These are real diseases that change the brain. And I hope that people, when people begin to understand that, even if they're not generally just compassionate to people dealing with this, that at least there'll be some medicalization and some science that backs it up.
And not only does the trauma change the brain, but the drugs also change the brain as well. So that's
Exactly.
double the amount of changing the brain.
And
So yeah.
usually, if you're dealing with trauma and substance use disorders, there's other comorbidities too, right?
Yep.
So,
Yep.
and
Yep.
that's what I teach. I'm like a old school, just like help everyone kind of person, but over time, I've worked to get into the science more because I think that not everyone is just going to be compassionate because they're going to be compassionate. And so if we can work to like educate, you know, hopefully, I mean, you guys already, I'm sure, have the compassion and the caring, but it's still good to have the information, right? So now we're starting to understand with brain imaging, like some of those pictures I showed you, what happens inside the brain, how it's different with trauma, how it's different with substances. I mean, there's an amazing study that showed people who were IV drug users and had stopped, and they would give them an IV with nothing in it. They knew they were not getting their drug, but when they went to put the IV in, their brains would light up as if they were getting the drug of choice. So that's a huge change, you know. So we're starting to know, become aware of much of the imprint that's left on the mind, the brain, and the body. And I like this quote that trauma results in fundamental reorganization of the way mind and brain manage perceptions. So, in short, trauma changes not just how someone thinks, what they think about, but their actual capacity to think, because we just talked about the fact that that executive functioning gets decreased, right? Has nothing to do with intelligence or ability, but it's being tamped down. And that can also be a problem for communication. And one of the reasons I think that matters is because people who've experienced, especially multiple traumas, but any amount of trauma, if they're in a traumatic situation, sometimes we are like, well, why don't they just say no, or why don't they do this? And sometimes that is actually not possible, that they actually can't communicate and think in a way there. Remember the freeze, right? So we know that trauma can have lasting effects on someone's mental, physical, emotional, social, and spiritual well-being. But not everyone who's experienced a traumatic event will have these long-lasting effects. About 20% who experience a traumatic event will develop post-traumatic stress, and others might have, sub-threshold symptoms. So they have symptoms, but they don't quite meet the diagnostic criteria. So if any of us are experiencing some level of trauma, vicarious trauma, compassion fatigue, burnout, or just daily stressors, which of course we all are, there are things we can do to improve our quality of life, our work life, and our general mental health. And that is this is where we get into the positive, more positive stuff. So let's talk about authentic self-care. Does anybody feel like they know what I mean when I say authentic self-care rather than just self-care?
Maybe self-care in a holistic view, like mind, body, and soul. Like
Mm-hmm.
that. I don't know. I don't know.
No, that's great. Thank you. Definitely that's a piece of it for sure. So, let's start by talking about why do we do this work? So, who wants to share either in the chat or unmute a reason that oh, I like that, Melanie, planned and intentional. Yep, that's definitely part of what's unique to you individually. There you go, Delsu. We're gonna get there. Yep, excellent. So, why do you do what you do? Why do you do this work?
Sorry to talk so much, but I talk a lot.
I I love that you are talking so much.
Okay, good, good. I got into this work because of the fact I didn't have my like somebody like me helping me when I was going through my
Yep.
drug abuse and my trauma, and I didn't have that light at the end of the tunnel for very, very long time. And I had to find it myself. And it would have been a lot easier if someone would have just shown me the light a little bit
Thank
and was
you.
there for me, you know. I wish I had that. So I do my job because, and it's not even a job to me anymore. It's like my life goal.
Yep,
It's to
yep.
just help whoever I can.
Amazing. Thank you.
Yeah.
So I'm going to read a couple of the things from the chat that, if I can get it to cooperate. I want to be part of the solution. Excellent. To be a person I didn't have when I was struggling, like you said, Kaylina. To help people and also to help me maintain my healthy life, being a part of helping people succeed. Excellent. I love that, Brandy. To see change in others for the better. I can relate to others' insecurities that they're afraid to voice. Yep. Thanks, Veronica. To try and help end the vicious cycle. Oh, I love that. To help people know there's another way of life than drugs and alcohol. Thank you, Cynthia. To help people feel less alone with their experiences. Cheyenne. Oh, that's beautiful. Lisa said, I used to think self-care was volunteerism because I really enjoy it until I was challenged about what I do for myself. I had to reassess what self-care should look like. Now I do those intentional activities for myself. Awesome. We'll talk more about that in a minute. I love my work because I can relate so much to my peers. That is wonderful. So, oops, I didn't mean to go back. Okay, so a couple reasons that I put was, we want to help, we're caring and giving people, we know someone who has a substance use disorder, or we're recovering ourselves. I see in the chat, let's see, go up a little bit. Amy said, there's so many reasons I'm in recovery. My fiance is in recovery. My family is in recovery. Some family still uses, and I've lost a lot of people to substance abuse. Yes, powerful reasons. And to be an empathetic listener and know there is hope besides suicide and having coping skills. Excellent. So basically, a lot of what this comes down to, I think, is the last thing on this slide, which is we want to make a significant impact. And this is an area that we know we can do that, right? And so I just need to pause and say that you're all amazing. You're all so amazing. Oh God, it's a special breed, I think, that works in this field. And I love working with all of you. It's just, not everyone goes to work to help people, right? I mean, that's like weird to me, but it's just and Casey said to give people hope that recovery is possible. Yes. So the good news is that, a lot of us have empathy and compassion. We're giving and generous. We want to share those experiences and hope, and we're personally invested in other people's success. But of course, we know that our strengths are also risk factors. So the fact that we have such caring natures, the fact that we might have histories with vulnerabilities or with trauma or other things of that type, the fact that we want to give so much might mean that we're so invested that there might be some transference or countertransference. We might have trigger types, like because of my stepmom and her alcohol use disorder and growing up with her, I do not do well with clients or folks who come kind of like a victim type, like not someone who's a true victim and sharing that, but someone who's like, oh, poor me, everything happens to me, right? That's like a group that I struggle to work with. Doesn't mean I can't, but and a lot of again, what are good things like how much you guys give, how much you get your sense of self from work? All of that is beautiful and amazing, and also puts you at risk for potentially being burnt out, being re-traumatized, etc. Which is why I want to do this with you. So some work challenges you might experience is like meeting with one client after another, working with coworkers who might be negative or energy sucks, right? Or toxic in some way. You might have a difficult boss, challenging client issues, depending on, paperwork or auditing or, all different requirements can be difficult. And sometimes we don't feel appreciated or fulfilled, although it sounds like a lot of you do, which is awesome. Lisa said, I'm in recovery. I work as a certified peer support specialist, so I work with people with trauma and anxiety, which I also have experience in recovery from. Awesome. They are lucky to have you. So what are some red flags? So we come to this work with all of these strengths, all of this desire to help, empathy. What are some things that might say, I need to pause and make sure that I'm taking care of me? If you're feeling less tolerant, if you're feeling less empathy, or maybe some apathy, if your energy level is depleted, you're more reactive, if you can't leave the job at work, which, probably a lot of people who do this work and care about it so much, that might be challenging. If you're feeling that desire to control that we talked about earlier, if you're feeling perfectionism and depression, starting to privately judge peers about their decisions. Oh, that's a good one. I have to add that. Thank you. There's more, of course, right? But these are just some for us to think about. So I don't know how many of you are familiar with Brene Brown, but her work has really had a huge impact on me. And this quote I thought was really important. She says, very early on in my work, I discovered that the most compassionate people I interviewed also have the most well-defined and well-respected boundaries. It surprised me at the time, but now I get it. They assume that other people are doing the best they can, but they also ask for what they need, and they don't put up with a lot of crap. Compassionate people ask for what they need. They say no when they need to, and when they say yes, they mean it. They're compassionate because their boundaries keep them out of resentment. So if I'm always saying yes to everyone else, but inside I'm like, oh, I need to, I'm so busy and why is so-and-so always asking me for things, etc., then we are hurting ourselves, and we're not really doing ourselves any good with those relationships, because ultimately there's going to be resentment, there's going to be problems. So that's why boundaries are such a key piece. So doesn't matter if you have the trauma we've discussed, or if you have absolutely no symptoms, nothing negative at all. You're a self, so therefore you need self-care. Just like our cars, our houses, everything, the care is required. So self-care is not selfish. It's not an afterthought or unimportant. It's not something that you're like, okay, I'll eventually get to that. It's not an indulgence. It's not a trend. It's not only for those who have money, and it's not only for those who have tons of time. So what it is, and some of you started talking about this intentionality, which I love, being deliberate in taking time for the betterment of your mind, body, and soul. It's necessary. Like, you can't not put gas in your car, right? You can't not take care of it. It includes any intentional activities you take for your physical, mental, and emotional health. Self-nurturing methods that affirm and protect us as we take care of others. And it's an essential underpinning in the best practice of the profession of social work. So I thought this was really interesting. Research done by John Adams. He's one of the leading experts on occupational stress. He talked about these 4 strategies that are sort of work less hours and work smarter in your lifestyle type of solution. So he says, build resistance through healthful lifestyle. So deep relaxation, nutritious diet, supportive friendship. These are ways that we have resiliency from vicarious stress or burnout. Try to, I know this is hard for some of you, try to compartmentalize your work life and your home life. Engage in regular physical exercise. This is one of the ways we decrease our adrenaline and our cortisol and all that. And interrupt strained situations and withdraw from them if they become exhaustive. What do we think that means? Stay out of the drama. Good job, Lisa. Shut it down, remove yourself. Veronica, thank you. Boundaries or timeout, Rebecca. Yeah, excellent. So if I step away when you need to. So if I am, I like it. Take a break if you need, if you feel burnout, walk away, take a break. So I think it's really important to think about strained situations. So maybe you have, it could be at work, it could be at home, it could be a lot of different ways. And yeah, Amy, good job. Remove yourself from the situation if you see or feel the signs of physical stress. So sometimes it's sort of easy, right? I'm feeling this thing at work. Hey guys, I'm just going to take a walk. I'm going to take a short break. But sometimes it's things like, I'm going to my family's house for the holidays, and that is a really stressful, straining situation for me. Maybe I need to not go this year. Maybe I need to make it a shorter visit. There are things that can be really difficult to do, but important if it's not healthy for us. Okay, so authentic self-care. So if the idea of doing meditation or yoga is like, ugh, or if you don't want to be, you don't want to go meet new people or be in a crowd for an activity, or like if you're a weirdo like my mom who doesn't want to ever get a massage, then those are some of the sort of traditional things we think about with self-care, right? Especially when it came out trendy. You see the person going to yoga and getting a Starbucks and getting a massage or joining a group or whatever. The authentic part here is that it has to work for you. There's not something that you're supposed to do to be doing self-care right. And like Kaylina was saying, it's also really important that you're not just meeting one part of your needs. So what are you needing in different areas? Yes, Amy, I almost just literally said that. Self-care is not one size fits all. Exactly. So some people maybe are great about working out, but they never take a quiet moment to themselves. So maybe they are physically good, and they're even like to some extent their stress level is good because they're getting rid of some of that cortisol, things like that. But they never just sort of sit and like journal or pray or meditate or something that's a more spiritual need, right? Maybe they're taking care of some of their other needs, but they never like think about, someone said earlier, like, what do I like to do? What do I want to do? And it requires self-knowledge. It requires courage to listen to your own needs. And it requires boundaries and being able to say no, which is very hard for a lot of us, right? So Delsu said, volunteer once a week, equine therapy, help me exercise and be around horses. That sounds lovely. That's a great one. Okay, so I would like you all to take a minute this is out completely for yourself. If you don't want to share, that's fine. If anyone wants to, that's great too. But I want you to take a look at this slide and think about a need that you maybe haven't been focused on, like your spirituality, your physical, your social well-being, whatever it is, and kind of think about or write down or whatever works best for you. What's the impact? Like, play that tape out. What happens if I continue to not take care of that? So I'll give you an example. If I have an injury, and like I'm a big runner, so let's say I have an injury in my ankle, and I'm like, yeah, it'll be fine. I don't have time to go to the doctor. I'm not going to take care of it. You know, if I continue to do that, does my physical injury get worse? Do I end up having to miss more work or having to have greater costs? You know, there's a cost, right? So I'll be quiet for a minute and you can think about these questions here. Okay, does anyone want to share any of their thoughts? Lisa said, I literally took a year off of work when I had several deaths in the family in a short time because I didn't have much left in my own reserves to give to peers. Excellent.
So I just started to work out again. I actually started today. Um, and
Woohoo!
I feel amazing. I have that not runner's high, but I have that feeling of like, oh my God, I did it.
Yes. Yes.
Yeah.
Excellent. That's great. So
Yeah.
what led you to that? Like what was the need or what were you not getting for
So,
your
so my end goal is to get bariatric surgery. And I have to lose weight in order to do that. I have to lose a certain amount of weight to do that so I can be here for my son longer. My mom died of heart failure, so I'm trying my hardest to not die the same way. I lived a pretty rough life the last like 10, 12 years. And it's definitely taken a toll on my heart. So I'm trying to work on making sure my heart health and my body health and all that stuff is in line so that I can stay here for my son.
Oh, that's
Because
wonderful.
he deserves his mom for however long he needs his mom.
Yep.
Yeah. Yeah.
Amazing. Amazing. Thank you.
Yeah.
So Carrie said, I never take time to do things I want to do, such as walking alone, doing my nails, going on trips I would like to take. Yeah, exactly. Exactly. That is so important to look at what are the things that I would like to be doing and what is stopping me from doing them and what is the cost if I don't do them. Um, Same with me. I'm doing the bariatric process for weight loss. This is Cynthia. I have to lose some weight. I want to do it so I can have a better life with my granddaughters and do things outdoors with my husband. Wonderful. Excellent. So thank you guys for sharing. Athena, did you want to say something?
Yeah, I would just wanted to kind of go along the same lines as like I would like to work on my physical health a little bit more. I mean, I work full time. I do school 3/4 time, and so I feel like I have no other extra time for myself as in like my physical health. I'm also a type 1 diabetic, so it's really important that I get get my physical stuff underway. I haven't started yet, but really, really want to try to do that for myself.
Thank you so much. We're going to talk about like how it can be difficult to find the time, and I'm going to kind of give some ideas and suggestions and things I've done. Um, Someone said to me, what if instead of like, I can't find the time, if you said, um, well, that's not a priority right now. And I was like, oh, that wouldn't feel good. You know what I mean? Like if you said, it's important to me, but when we say we can't find the time, another way of thinking of it sometimes is like, are we not prioritizing that? So let's see if we come up with some ideas for you, Athena. Thank you. Bethany, I want to do more things with my family, such as traveling and just going to simple places that are around me. Excellent. I like how these are um, like manageable things that we can fit in and we can start to do rather than, when it's too big, it can be really scary and overwhelming, right? Or it can feel like we can't do it. So one of my favorite questions is like, what feeds your soul? Like how do you recharge? And hold on, I have to respond to this. This is so good. So Carrie said, we can make time for what we want, which can feel selfish. That I think is a huge part of the issue. Like, especially for all of you who are helpers and givers, it's like if I'm doing something for me and someone else wants that time and I say no, it feels like you're being selfish. And I think we have to try to get past looking at it that way. I'm going to share a story in a minute, but I'll tell you that I get up at 6 every morning and I work out, I take a walk, whatever physically I need to do by myself. I listen to my podcasts, etc. And that is sacred time for me. Like I don't let anybody else impede on that time. And that's not selfish, that's self-preservation. That's my mental health. I teach, I have 2 children, I do all these different things. And hold on one second, my plug is not working for some reason, so my laptop's gonna die. I've had it plugged in this whole time, but let's see. I think we're okay. So it is really important to realize we have to take care of ourselves or we can't, we know that, right? Like we know it, we hear, you have to put your oxygen mask on first or all these things, but it's like we know it, but we have to like know it in our soul and really start to take on like I know that if I don't do my physical activity and my time to myself and my walking and whatever, I'm not going to be the best mom. I'm not going to be the best partner. I'm going to be more, potentially irritable and all different things. So yes, it can feel selfish. And I hope that part of what my training and my work here will do is help you to start to think like it's not selfish, it's necessary. I see Brandy said, get my house organized. I am widow with boys and I'm involved in their sorts and their lives plus client neglect my organization. It's clean, but I would like, sorry, it's blocked here. I would like everything to not be stuffed. Yeah, so that's a way to feel like we gain some control too, right? To like clean up the clutter. That's important to me. I really, yeah. Would like to get in nature more. I like that with the dogs for some quiet. I love walking. It's a huge thing I do for me. My meditation is essential. I've noticed when I don't take time for myself, I end up feeling on edge and angry with every little inconvenience. Being a new mom, my goal is to be the mom I never had, and I can't do that if I'm always on edge and upset. I'm still honestly trying to learn how to better attend myself. Yes, 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 a million times yes. You can't give, you can't give from a cup that's empty. And it's just, and I'm gonna, there's a lot of benefits and there's a lot of negatives of not doing it. So, and honestly, it may seem selfish, but when you start to do it, what you'll find is other people will start to go, oh, that's a good idea. Or, oh, I want to be like when people hear self-care, they think of me. They're like, I need to do more self-care, and Carrie's inspires me. And that's so important. That's so good. And that's something that I know all of you that's important in your life, to be that person to other people. So when I think about this, what feeds my soul, or how do I recharge? I have this story that amuses me. I go paddleboarding. I mentioned I live in Tampa Bay area, and I do stand up paddleboarding. And I'll get on the paddleboard. I'll find my balance. I'll start to paddle out, and I'll get away from the beach and the people and everything, and I'll start to get near where there's like the mangroves and it's really pretty. And I always hear this weird sound, and every time I'm like, what is that? And then I realize it's me sighing. I'm always like, because it like, and I'm not joking, like it happens to me every time. I'm like, what is that? Because I'm letting go of everything. I'm not attached to my phone. There's no one there to ask me for anything. I'm in nature. I'm being physical. It really works for me. That's going to be different for all of you, but you got to find what is that thing that makes you let out a big sigh. And just, like if you have a dog, if you have a puppy and you hear that they lie down and they do a little puppy sigh and they're so happy and relaxed, we need to find those moments. Okay, so boundaries and other self-care tools. I made a little self-care toolbox for you, but you have to put the stuff on the tools because it's going to be different for each of you. So self-care is a skill. It requires practice because we go, oh, I'm being selfish. Oh, I don't need to do that today. My sister wants me to do this, or my kid wants me to do that, or my boss wants me to do. Put it in the calendar. It's as important as anything else. I don't like, my partner will be like, oh, let's stay up and do blah, blah, blah. And I'm like, no, because I need to get up at 6. Sorry. If you want to watch a movie with me, it has to be at 7, and the people in my life know now. So you don't have to you have to set boundaries, but eventually it's not as hard. It's hard at the beginning, but eventually people know. Like my kids don't ask me to do something at 9 at night because they know mom's gonna be in bed, and they don't ask me, like there's things that become, people know, right? So our self-care can be improved. It can and has to be prioritized. It can become second nature. It can be modeled, which I think is amazing for our kids, for our peers, for our clients. It often has to be taught if you didn't grow up with it. If it's, certain populations and cultures, it's just not going to be there. It does not have to be expensive. I think this is really important because I think, people think you have to, like I said, get a massage or go to a yoga studio or do certain things. And you don't. I literally walk out my door and go for a walk. The other thing I do is I have weights and stuff in the back of my vehicle. So like I open up oh, I didn't tell you guys my story. So when my kids were 4 and 7, their dad left the state for a year and a half. I didn't have any financial help. I didn't have any physical, emotional help. I was doing it completely on my own. I worked in social services, so you know how much money we make. But I was a big runner. Mostly at that point, mostly running. And I was so sad because I was like, that part of my life is over. I'm not gonna be able to run. I have a 4 and a 7-year-old and nowhere for them to be and no one for them to be with. And I don't know how, but some kind of light bulb went with me, like, no, I'm gonna find a way to do this. So we lived in this home on like a residential street, and it was really, it was short. And I would get up early in the morning when they were still sleeping, and I would literally, this was our house, I would literally run up and down the street where I could see the house all the time. And if they needed me, they could come out. And sometimes they'd come out in their jammies and, mom, I need whatever. That was how I made it happen. And if you looked at my GPS, my runs were like this, not even a quarter mile, back and forth, back and forth, back and forth, but I did it. And so I say that sort of to both encourage and challenge you that you can always find time if it's really important to you. You can find a way, And it's doable, and that wasn't like ideal. I didn't, I would have liked to go off and just run. And sometimes my workouts got interrupted by a bad dream or someone needing water or whatever. But most days I did it, and it was me time, and it was staying physically active. And if I can do it in that situation, I think most of you can find a way to do it. Amy said, I believe being a single mom has caused a majority of my mental health because I never took the time for myself. I exhausted myself pouring all my energy into my son and work. I can relate, absolutely. And, I also look at my kids and I think that they need to see mom taking care of mom when possible. And they need to know, that I will tell them no. And another thing that's nice about it is because my kids know that I like to be physically active, if they're trying to take time that maybe normally I like go for a walk, for example, like my oldest now will be like, instead of your workout, do you want to go play tennis with me? And I'm like, okay, I can do that. So, it's a win-win. So here are some things you can put in that toolbox I gave you. Clear, firm boundaries. So no is your best friend. I can't add on something else to my single mom working life. Finding some level of healthy detachment. Not everything is my thing to be completely invested in. Sometimes someone else is going to be unhappy. That's not easy for us, right? It's not easy to know. I could make something different or better for that person. Regular social interaction. Trying to find personal fulfillment. Gratitude practices, this is my favorite. We'll talk a little more in a minute. Spiritual practice. This is one I think is really important too. Watching your exposure. My partner likes to be on social media and he'll like tell me some terrible story or show me some video and I'm like, no, I'm not, I don't need to hear. I know people can be terrible to each other. I don't need to see a video of it. I don't need to hear it. So just being mindful, like, what are you watching? What are you letting in? What are you hearing? And how is it affecting you? And that's something we can control most of the time, right? So Lisa said, experience in the past, codependent relationships can also drain a person and make it difficult to make boundaries that encourage your own self-care. Yes, as a very, like I said, recovering codependent, this is why boundaries are such a big deal to me and why I'm, no has become a good friend of mine. So these are two that I have found to be key. They may not be perfect for you, but also they're very adaptable. Gratitude practices and mindfulness practices. So gratitude exercises can be super easy. When I was, like I said, single mom, my kids were younger. One thing I would do is I would at dinner do something we called roses and thorns. And I would say, give me your roses and thorns. And a rose was something good that happened that day, so something you're grateful for. And a thorn was something that was maybe hard that day. And it helped us to focus on positives, but it also helped me to see what was happening with my kids, because those of you who have kids, how was your day? Fine. What happened? Nothing. And so that was a really good one that we did, and I taught them, some level of modeling there. Let's see. No is hard for me. Yep. Recovering codependency. No. I say no. People around me don't listen to my no. Having boundaries I learned with being a peer and family before I learned them in my personal life. I'm still a work in progress. Aren't we all? In my PHP program, they would start every day with our gratitude list. Yep. And our daily SMART goal and a positive affirmation. It was amazing. So you can do that. You can do that for yourself. Put it in your phone, put a reminder, do it yourself every day. Gratitude is a big deal. I can also be grateful for things I don't have, as in negative things. Oh yeah, especially for those of you who've been through a lot. I'm grateful I'm not there, right? So when my dad died, I wrote grateful things every day. It really helped. Yeah, thank you. So a great one is journaling. You can put thoughts and emotions on paper. That helps us with self-awareness. It can improve regulating your mood. Sometimes I'm like scribbling like stuff that pisses me off, right? So I don't say it to people. But you can do 3 things you're grateful for each day. It's nice, like you can lie in bed before you go to sleep and say, just think of 3 things you're grateful for. You can find gratitude journaling prompts online. You can ask people what they're grateful for. I mean, their research shows the benefits of gratitude are huge, and you don't have to do that much. And I think we can always find gratitude even in the worst times. Mindfulness, I think some people think that it's like this, new age voodoo, and you have to like have your meditation, special place to sit or whatever it is. And it's just about being in the moment, being intentionally present in the moment. It can be done when you're washing the dishes. You're just intentionally feeling the water in your hands, looking at the dish, whatever it is. It can be done when you're walking or breathing like we did together earlier. And starting your day with mindfulness practice has shown to help with stability and gratitude. And by focusing on the present moment, we can reduce stress and promote emotional balance. And if you think about a lot of the things we've talked about today, if you're intentionally present in the moment, especially with like breathing or bringing your thoughts to this moment, that's going to help with that stress hormones and with helping your brain know you're safe and you're here. So grounding techniques are another wonderful thing. We did some with the breathing. They can help us stay connected to the present moment, and it can help with like distressing emotions. I feel like I'm gonna sneeze. Excuse me. Grounding can actually help us feel like safer and calmer. So I'm actually gonna have us do a grounding technique right now. So if you're able to sit like we were earlier, we're gonna keep our eyes open this time. Or stand wherever you are, just trying to feel your feet in the ground, feel your body here in this moment. And you're gonna, in your head, think of 5 things that you can see right now. Doesn't matter how big or small or what they are, just think of 5 things you can see. And then think of 4 things that you can feel. Could be your feet on the ground, your seat on a chair, breeze, whatever it may be. 4 things you can feel. And then think of 3 things you can hear. Maybe it's my voice. Maybe there's people where you are nearby quietly, or the air conditioning, or whatever noises are happening around you. Gets a little bit trickier. Think of 2 things you can smell. And then 1 thing you can taste. Maybe if you had breakfast or you had coffee this morning or water or brushed your teeth, whatever, 1 thing that you can taste. So when I'm feeling particularly anxious or overwhelmed, this is really nice for me. And I also think it's another nice thing that we can demonstrate and do with our clients. Just a simple grounding technique. There is a resource called 101 Mindfulness Grounding Techniques that have 101 things like that are really simple and nice. So also, it's not all that serious. You might like cat videos or, anything that kind of makes you laugh online. Maybe you are into sports or music or art. Someone mentioned volunteering. I will say, you're absolutely right that you have to find something that's for you. But the research does show that volunteering is really good for our mental health and for our self-care, because like when I go to work, I have all the components of my job, right? But when I go volunteer, I'm like, I just go in, I do the task, I feel good, I helped, and I leave. It doesn't have the sort of bureaucratic or all those other steps. So it is a really nice thing. Connecting with others, laughing. It's so important to laugh every day. So what is it that, makes you laugh? What is it that brings you the sigh that we talked about earlier, or, joy? So making sure that you make some space for those things. I started recently taking an adult acting class. And, sometimes it feels awkward. We do improv and different things, and sometimes I feel weird, but it's important to me, and it's something I've wanted to do for a while. Brandy, did you want to say something? Okay, you unmuted, that's why I asked. All right, and Esther said, when I want to relax and forget about things, I watch cat and dog videos. They make me laugh and it helps. Yeah, my partner he watches all different. There's a person in Thailand who like helps stray dogs that have, been hurt or left alone, and he watches his videos like every day. So it can make you laugh, it can feel inspiring and positive. So, but again, it's going to be different for everyone. So, to Athena's point, which is always comes up and is totally understandable, is how can I find time? So one of the things is those boundaries, right? You have to say no to sometimes to people to find the time. Sometimes we are asked things of us from work or clients or family, or even our own expectations. Sometimes what you did was good enough and you don't have to spend more time on it so that you can have some time for self-care. And so, when we don't say no, when we don't make the time for ourselves, then we our compassion gets eroded, and we might feel that, burnout, or we might feel that our resiliency is less. When we fail to set boundaries and hold people accountable, we feel used and mistreated. That's why we sometimes attack who they are, which is far more hurtful than addressing a behavior or a choice. Esther says, I don't answer my phone on Sundays. It's my day to do what I want. I love that. That's great. And maybe it's things like trying to work on people pleasing. Setting boundaries when we're someone who always wants to help is difficult. So we have to learn to try to stop people pleasing and set those boundaries. You might have to rehearse saying things like, I can't take that on, my plate's full. I asked someone for a favor, and today they wrote back, I had messaged them and they wrote back, I don't have the bandwidth for that right now. And that's great. I wanted them to do it. I'm disappointed that they didn't do it, but that is entirely healthy and within their right to do. And the other thing we talked about briefly earlier was that we have to be able to sit with discomfort. It is so much easier for me to say yes to you, and then I'm not worried that you're mad at me or that you're upset or that, whatever. I might be resentful, but that's like, oh, well, I'm dealing with that. But if I tell someone no, and they are clearly not happy about it, I have to be uncomfortable with that. I have to be okay with being like, it's okay that I said no, and it's okay that they don't like it. And it takes practice, and it takes time and mindfulness to be able to say, it's okay for me to say no, and it's okay for them to not like it. So there are tons of benefits to improving your boundaries. You become more self-aware, you're a better friend and partner. I would way rather say yes to you because I want to say yes to you, not because I feel like I have to as an obligation, right? You take better care of yourself, you're less stressed, you communicate better. So, when we use boundaries, we use assertive communication typically. Like I said, that person that I asked a favor said, I understand what it is you need, and I wish I could help, but I don't have the bandwidth right now. Okay. We tend to be less angry and resentful. We learn how to say no. We do the things we want to do. We become more understanding as a person. So because I have better boundaries over the years, the fact that this person said no to me, I'm not angry. I'm not upset. I'm understanding to that. And we tend to trust others more when we have stronger boundaries. So when you're looking at your self-care plan, which we're going to discuss in a minute, we have to look at our own feelings rather than being led by others. And we have to look at things that we think will rejuvenate us. If you're used to doing for others all the time, you might not even know what it is that you like to do, what you find valuable doing. Okay, so your self-care plan is going to be individual and unique like you. You might want to schedule a certain amount of time every day. Someone like Athena, maybe that's not going to work because of classes and work. So maybe you pick, like someone said, Sunday. Maybe you pick 2 hours once a week, right? The important thing is that you do it. Sometimes people will say they will do things that they absolutely do not intend to do. When questioned, they almost always say they did not want to be rude by saying no. This leads to resentment because the people are depending on the promise. I will say no whether someone has an issue with that or not. That's a great point. If you don't want to say yes to things that you don't intend to do, that makes it worse as well. So, you have to be creative and persistent. You have to decide that self-care is important to you. Like in my example where I'm getting up in the morning, I might not get as much sleep, and it's like kind of not the best running conditions, but it's what I can get and I'm going to do it. So, someone who has a very busy lifestyle might have to say, I can only do self-care stuff. I can get up early on Saturday morning and go to a yoga class, or I can go to a movie once a week, or I can, whatever that might be. This is a resource that I like called the Self-Care Wheel. And you can see that it has that holistic material we discussed. So it's nice because you can be like, I think I need something spiritual, and I'll give you some examples. Or I think I need something psychological. I'm going to practice asking and receiving help, or I'm going to think about positive qualities. So it helps you with ideas. These are some examples as well. You can see there's the empty self-care wheel, so you can write in there what you need. You could put, so-and-so's self-care plan. This is what I'm going to do for my mind, body, and spirit. And I like this with clients too. Who are the supportive people in my life, and what are the things I want to accomplish? And then this one, the first one, the 30-minute self-care. Is it rest or relaxation? Is it expression? Is it companionship? Or is it health and spirituality? So Athena, can you give yourself 30 minutes a week? I might have lost her, but I hope so. So, if you feel like, okay, I need rest and relaxation, maybe you're going to take a bath or shower, take a nap, read a magazine, whatever it might be that fits there. Okay, so we are great on time. We have a few minutes left. I would love to hear if you have questions, if you have comments, if you're like, that's a bunch of hooey. I challenge you because this is what doesn't work or can't work, or I don't know how to do that. Any of that is I'm very open to it. Okay, in the chat, I see. It was great, thank you. Yay. Yes, you're getting a copy of the slides. I think the link was put in here, is that right, Mary? Thank you, Carrie. I love doing
Yes, we'll put it back in.
Okay, great. So we're gonna put in a link. Wonderful information. Well, thank you. I'm getting all the love. I love it. Okay, good to know. The science, some of the brain science, Amy, is that what you're referring to, or prior to that? Okay. Okay, the survey is there. I want to make sure I'm not missing any questions or anything. The brain science, yeah, it's a lot, I know. Appreciate your time and expertise. Thank you. Yeah, the brain science can be a lot, but hopefully, you know, you leave with the important pieces of it, right? So this is my contact information if I can ever do anything for any of you, or if you just want to say hey. I'm teaching at the University of South Florida. That's my LinkedIn and my email address, and always happy to hear from any of you. I really appreciate how many of you were actively participating, and you know, I could see your smiling faces, or those who were putting things in the chat. It always makes it much nicer experience for me as the presenter, and to make sure that what I'm giving you are things that are meaningful and helpful. So I appreciate that.
Thank you, Carrie. You have given us all good things to do to take care of ourselves. And I, for one, can always use any help with self-care. I will send an email in the next hour with the survey link and the links that were in the presentation. And I'm going to remind you to check your confirmation or reminder email for full CEU requirements. So you'll get that survey link, and it will be open until noon on Thursday. I have to get it straight because we had that holiday this week. If you have any questions, use the Empower Idaho email. Eden will put it in the chat, and the slides and recording will be available on the website in a couple of days. Thank you all for attending, and thank you again, Carrie. I know it's been tough down there in Florida with Milton and Helene.
It has, but this was a wonderful thing to look forward to, and I enjoyed it. So thank you so much.
All right, that sounds great.
Bye, guys. Take care.